This hour of the CHEO Telethon is brought to you by Guardian Capital, investing in children and youth health and fueling their dreams.
Welcome back to the CHEO Telethon, Hour 2, your chance to meet some incredible kids like Kala and Jaden. Their stories are coming up, and you can make a difference in the lives of children and youth with your donations. Our phone bank is back this year. They're all set up at the new Lazy Boy Lounge right here at 87 George. They are ready to take your donations. We will also be inside CHEO with CTV's Jackie Perez and our enthusiastic phone bank host, Stephen Keys, with Jackie right now. We want to check in with them. How are things over there, guys?
Things are going very well. Wouldn't you say, Jackie?
I'm loving walking through our volunteers, and they're telling us all these beautiful stories about people calling in and their reasons why. And you have a chance to call in now, and if you have your smartphone, make sure to put it up to that QR code that we have and scan to donate. So we have a very special story.
That's right. Speaking of beautiful stories, Jackie, Joanne is here. She's taking a little break from taking calls because you got a special one.
Hi, I just want to tell everybody my great niece was born 2 years ago today, and she was a CHEO baby, and her family called and donated, and we hope you will too.
That's right. So the families appreciate this. You can hear their stories. They keep coming back to tell their stories. They come back to make donations and give back to the hospital that has given them so much as well.
Yes, and we've also talked to a patient, and you'll hear from her later in the show. She is now working at CHEO as a specialist, so we'll tease that for a little bit.
Love those stories, Patricia.
All right, thank you guys. And of course, CHEO Telethon Day, all about the kids. We've met some wonderful kids already. We're going to continue to meet more kids and their families over the next couple of hours. And Rosie Etta is located at the center of all the fun, playing games, chatting in the Kids Zone, Rosie.
I am here. Thanks, Patricia. Yes, we're playing games, we're chatting, and we're also maybe having a little bit of a juice break here. I notice there's a lonely juice box. You know, when you get kids around and they're playing, inevitably something is left behind. So I don't know. I've got my eye on that juice box. I'll look around and ask the parents if it belongs to any of the kids. And if not, I'm going to have to help myself to that juice box because, you know, it takes a lot of energy to play with these kids. No doubt about it. They're having a great time. We're going to speak to so many more kids and families and find out what CHEO means to them. Patricia.
All right, thank you, Rosie. Good stuff. We'll talk to you again in just a little bit. And CHEO is not just a place that provides life-changing care. It does that, but it's also a leader in research and innovation. Dr. Jason Bourbon is joining us for this hour. He leads the team as president and CEO of the CHEO Research Institute. Thank you so much for being back with us this year.
Thanks so much for having me. It's really exciting to be here on Telethon.
Okay, so tell me about how important it is to have a research lab that's right there on the CHEO campus that is able to be part of so many innovative studies. How key is this?
Well, you know, the Research Institute isn't separate from CHEO. It really is very integrated, and research really is care. Today's treatments are from yesterday's research, and today's research is going to inform tomorrow's care. And so we really work very closely with the doctors and nurses and all the practitioners at CHEO. In fact, many of them are researchers themselves, so they work really closely with the patients, know what the challenges are, bring those things to the lab so that we can try and find solutions and bring those back to the patients.
There's a nice stereotype out there about scientists, and maybe people say they think researchers are somewhat detached. Not the case. Certainly with those who are doing this kind of pediatric research with the kids so centered to the focus of what you're doing.
No, absolutely. Just like CHEO provides patient-centered, family-centered care, we provide patient and family-centered research. We have patients and families part of our research team, informing the research, making sure that we ask the right questions to find the right solutions.
Okay, we're going to have some time through the hour to talk about some of those questions and what some of those answers might be. But what is really exciting you right now in terms of the research that's happening there?
Well, you know, one of the things that we're looking at is how do we provide more tailored precision care. Every child is unique. Every situation is different. We don't want to treat all children the same. We should be treating kids with really specific treatments. And so understanding and providing personalized medicine that we call often from the genetic code to the postal code to make sure that we're tailoring treatment to address that child's needs both medically, but also socially, psychologically, holistically.
Okay, so Where does zebrafish come in to all of that? There's always excitement in this building when we run some of those stories about what's happening with the zebrafish. What does that mean to you?
Well, so that is an area of research that's near and dear to me. And in our lab, we use zebrafish as a model of childhood cancer and rare genetic disorders. And that really speaks to this precision health piece, because what we do is we take tumors from children. I'm a pediatric oncologist, a cancer specialist for kids, and we take tumors from those children, we transplant them into the zebrafish, test treatments that work and identify which ones will work best, and then are able to transfer that information back to that patient, back to that practitioner, really providing specific care, tailored treatment for that condition.
And how did you sort of get into that area? How did that become a major passion and focus for you?
So, I recognized that as a clinician, as a physician, I had the privilege to care for children with life-threatening illnesses with cancer. And while we've made great progress with cancer treatment, we don't win all the battles. And so to understand cancer better, we really need good models that we can understand the biology, understand what treatments work better with less side effects. And so I decided I want to dedicate my career to being a clinician scientist, both providing care for individual patients and also finding better treatments to improve care for future patients.
I could not count the number of times we've picked up a study and said CHEO is involved in this, and we're talking about it on the air, whether here on CTV, on radio. That all does not just happen, right? We're here today raising dollars for CHEO, for Roger Neilson Children's Hospice, and for this research, which is expensive, obviously.
Research is expensive, research is complex, and we don't get much in the way of government dollars to support this. Really, much of the work that we do is really supported by donor dollars, and so we're really, incredibly thankful for the support that we get from the donor community that allows us to do the groundbreaking research that translates into the types of care we want to give our patients.
We don't want to make it political, but it's unfortunate that there isn't more money that's just set aside for these little people that are the pride and joy in all of our lives, right? So huge that the donors are able to maybe fill that gap a little bit for you and let you do what you do.
Yeah, the donor contributions are really essential, and we've been able to make huge advances in many fields, from mental health to diabetes, thanks to donor support.
Love to hear that. We're going to drum up some of that donor support right now. Steph and Jackie are manning our phone booth for us through the afternoon, and over to you guys. How are things?
Well, Patricia, the phone continue to ring, and I actually was talking to Ray here. You've been a part of the phone line for about 10 years. What keeps you coming back each and every year?
It's amazing to get the community involved in what needs to be done for CHEO and to help everyone out. So it's important to be able to support. If you can't support financially, to support with your time, it's amazing.
All right, and that number again is 613-730-CHEO 2436. So 613-730-2436. Ray, you also mentioned that you have something down pat because you have been doing it for this 10 years. You have a tradition with your family.
Yeah, we while we're doing the phone lines, we actually call and make sure to get them to come in and call in and support. Hopefully we get them so we can talk to them, and if not, at least they're contributing as well. So.
I love to hear that. Thank you so much. During this a minute and a half, no one has called Ray now. He is waiting for you to pick up the phone. Call the number now, just down below here on your screens, and Ray will be picking it up. Maybe it's going to be Rachel. Maybe it's going to be Emily. It's taking a look here now. Again, this is going to great cause, lots of programs. I've had a chance to check out the construction that's going on at CHEO, as well as the updates that MRI is needed. We'll see that later on in the show, but we also even saw the amazing work that we've done from previous years and where these dollars go. So again, call 613-730-2436. Patricia.
Yeah, we know you all love going online, but they want someone to talk to. Let's give them a call. And as they do that, we are going to introduce you now to Tala. Despite her cancer diagnosis at just 3 years old, she has made a remarkable recovery, showing off her resilience and strength every step of the way. Austin Lee has Tala's story.
With her positivity and energetic spirit, it may be hard to tell.
Is your belly empty? Let me see. Let me check.
But at just 5 years old, Tala Arquette has already been through more than most people will in their entire life.
She's incredible. I can't believe that she's mine. She's such a strong girl.
When she was just 3 years old, Tala was experiencing back pain and a lack of appetite. Her parents, Mara and Chris, decided to bring her to CHEO to get checked.
She started having a little bit of trouble breathing. She was having fevers, and she stopped eating.
Doctors found fluid in Tala's lungs, and because she was so small, they needed to do a CT scan to guide them in the operation.
They said we couldn't drain the lungs because there was a big tumor.
Tala was eventually diagnosed with Ewing sarcoma, a type of pediatric cancer that forms in bones or soft tissue.
It just doesn't sink in that my 3-year-old has cancer, like.
She was very young, at 3 years old. This is often a diagnosis we make in our young adolescents. So it usually happens around the time of puberty.
The tumor growing from her 8th rib was about the size of a grapefruit in Tala's tiny body, pushing and displacing her heart and collapsing her left lung. For the following 9 months, the family barely left CHEO.
I knew that we were getting the best of the best. I just knew, in my heart, that we were well looked after. Every single person, from child life to nurses, doctors, they treat your child like it's their own, and you see it in their eyes.
Tala underwent 5 weeks of chemotherapy, and the tumor shrunk by 90%, a best-case scenario outcome to prepare her for a specialized surgery to remove the tumor, made possible by cutting-edge technology and the world-class team at CHEO.
Complex thing is because it's on the posterior ribs, it's close to the spine, it's close to the lung. There's a lot of very vital structures around.
In total, Tala had 5 of her ribs removed, and they will have to wait until she's fully grown to look at a permanent solution, possible reconstructive surgery with titanium prosthetic ribs.
She was left with a big chest wall defect, and with the thoracic surgeons, they were able to get this mesh that is kind of a really hard mesh to kind of recreate the chest wall, but it's not a replacement for the ribs. And so it's important for us to continue to follow her over the next decade to make sure that she doesn't develop any chest wall deformity, any breathing problems.
There's also a risk that Tala could develop scoliosis, but despite all the challenges, Tala is not slowing down. She's full of energy, and since her time at CHEO, has taken up swimming.
At the wave pool.
At the wave pool, we go every week.
Yeah.
Tala is well on her way down the road to recovery, and the relationships she and her family have made with the team at CHEO will last a lifetime.
Thank you so much. You have no idea how grateful we are, because you have always been a calming presence. You really have been.
Do I get a hug?
Yes, absolutely. I'm so thankful. I'm so thankful for all of you. It means so much. She's doing so well.
A lot of beautiful emotion there in that piece, and we have Tala's entire family here joining us on the couch, which is lovely. We had to scooch down to make room, and Tala is here with her CHEO bear joining us today, her siblings and her mom Mara and dad Chris. And Mara, just start with you, that moment that we saw on the screen where you feel that emotion for the people that love your kids so much.
Yes,
yeah. It was really, really beautiful.
Yes,
Yeah.
we're very grateful. She's come a long way, and seeing how she is now compared to where we were when we started, we're feeling very, very fortunate and very, very blessed. And so we want to pay it forward, the support that we received, and the emotional support, the compassion. We're so honored to be here.
Chris, something like this, you're the dad, the protector of your little girl, and you're told that something like that has to happen, that kind of surgery and that removal of the ribs, that, I mean, most people can't even fathom that that type of thing happens out there. What are you feeling in those moments? What are you thinking about this beautiful girl?
It was devastating, to find out, and we're just so thankful that CHEO is here in Ottawa and was able to take such good care of her.
Mm-hmm. How strong is she?
She's our warrior.
Absolutely. The feeling that you have that we saw on the screen for that one individual, and then there's a whole team that's all part of the care that goes into making sure that things are okay for your child. What do you feel when you hear the word CHEO?
In awe. I'm a registered nurse as well,
Okay.
And so I know the challenges that they face every day in the medical field. And just like I said, the compassion and the kindness, it's so pure. And you can feel it every time that they deal with you, from nurses, doctors, social worker. There's so many to name, but I'm just in awe. Yeah.
Chris, how has this been for the entire family? Obviously, you guys have a big, beautiful gang, and everyone is affected when one member is going through something like that. Talking about going through something, we're throwing right over the couch here. Those CHEO bears are flying. I love that. How has it been sort of for your family in terms of rallying and showing their obvious love for this one?
It was super hard at first, you know, adjusting to it, especially when she started on the chemo. Because she didn't have an immune system, so we all had to be like extra precautious. But we rallied together and we found our way for 9 months, and you know, and I think we grew stronger as a family because of it, for sure.
Yeah. You can throw the mic down to me here, and we'll see if we can ask Tella about that. Are you thinking about your bear that you threw over the couch? How good have your sisters, your brother all been? Your parents all looking after you? Are they a pretty good group?
Yeah.
And what about the people at CHEO? What do you like the most about the people at CHEO and when you have to go?
I don't know.
You don't know?
What about Zed? Huh?
Do you love the clown?
Zed.
Yeah.
He's
Zed
your
is-
favorite, right?
Zed is pretty cool. Thank you all so much for being here today. I'm gonna grab an extra bear here before we go to break, just to make sure we're covered off, because there's one behind the couch. There you go. We wish you all the very best as you carry on in your journey, and thank you for all coming in, supporting CHEO. We're going to continue to raise funds for families just like Tala's. We have one more miracle match.
This miracle match is sponsored by IFC Seafood.
All right, Steph, we're taking it back over to you. This is the time if people have been waiting to donate.
Oh, yes, Patricia. We are so excited to talk about IFC Seafood as a great supporter and sponsor of this miracle match. They're a Canadian-based seafood supplier. You may have noticed them at Costco. They're a vendor there as well. And they have been supporting CHEO for a long time. So why aren't you supporting CHEO? Pick up the phone, 613-730-CHEO, 613-730-2436. And did you know that CHEO is the only hospital in Canada that has a kids' clown school?
Yes.
Jackie, it's true.
I mean, I wouldn't think I need to go to this because I'm not doing very good with the juggling.
Oh, that's fine.
But we are going to start the clock right now for the miracle match. And
Now?
it is 2 minutes.
Now.
Zed,
Yes.
you're going to be juggling, I'm told.
Okay, yeah, I got two. I got the drop. Can
you juggle for 2 minutes without dropping them?
I'm gonna try.
We'll give you a little less than 2 minutes. All right, here we go.
Can I warm up? Can I warm up? A little
Anything you
warm
need, sir.
I mean, the clock is running out. That means the clock is also running out for you to call and make your donations. Come on, Zed. We're trying to get some donations, Zed.
We're getting down closer to a minute 30.
Okay, ready? 1, 2, 3. That's how it's done. Okay, you don't stop. You don't
Those
stop.
aren't the numbers we talk about. We talk about 613-730-2436.
So this is a good one. Okay, we'll try this one, a tighter one.
Folks, if you are enjoying Zed's entertainment, call in now, 613-730-2436. He's doing a great job
That's right.
bringing us this energy here today.
And all of you are doing a great job as well, because look at, she's on the phone talking to someone, he's on the phone talking to someone, and that's because right now, during this segment, we will double your donation. We'll double. How much time? How much time?
1 minute left in this miracle match. Call now.
Call right now. Just listen to them. Call right now. 613-730-2436.
And just
Those
a
are numbers
reminder,
we like.
I like those numbers. And
But
if
we
you know
also like
those,
numbers like $1,000 that we can turn into $2,000.
Can we get there? Can we get there? I'm hearing those phones ring. I want to see that.
Yes.
We're going to talk to the phone line here and see how much they are raising.
But first, how much time left, Jackie?
20 seconds. No, call now.
Just call now.
That's all. That's all you gotta do. Call now and they will match your donation. So $10, $20 will be donated. $20, $40 will be donated.
That's
but I
good
really
math,
like
Jackie.
the fans number. I'm a little nervous about the mathing.
We're journalists, not mathematicians, but we can do this math when it's for a good cause. $1,000, $2,000. That sounds pretty good
I
to
love
me.
those numbers. We are waiting for your call now.
Patricia.
Love those numbers too, guys. Thank you so much. And I love what we see happening over there in the kids zone. There's a whole gang over there keeping Rosie company. Rosie.
I am not alone at all, not lonely because I'm surrounded by so many great kids, all playing, having a great time. And I've got Lucky here with me now. Now, I told Lucky, okay, you can keep playing, but just give me 30 seconds so we can have a little chat about what CHEO means to you and how you came to CHEO. Lucky, by the way, looking very, very dapper from head to toe. How are you?
I'm great. I'm happy to be here, and thank you for inviting me.
It's wonderful to have you here. Now, as I understand it, you're a part of the new Kids These Days campaign with CHEO. Talk about that. How did you come in to be a model for CHEO?
Well, I have a cousin that works here, and she invited me here, offering me to this role to be in the new CHEO campaign, and I was very grateful to say yes, so I came.
Okay. Can we talk about, I think you were about 6 years old. Something happened trying to imitate Spider-Man, I believe it was?
Yeah, I was jumping on my bed, and then I was trying to do the Spider-Man pose, and then,
like, show me, what's this?
Like this?
Like that?
And
Okay.
he was my idol, so I tried to do it, but then my hand got stuck between my legs and it twisted, and I got a broken arm.
Oh, really? And so mom and dad took you to CHEO?
Yeah.
Talk about the care.
They were really nice. They took me to the hospital one day after that I broke my arm. And it was really cool because I really liked the feeling when they put the cast on me. But the problem was it was really itchy, so I needed to use a butter knife to really put it into my arm and scratch myself. So.
Okay. Were you scared at all when you were going to the hospital and had to get the cast on?
No, I was just happy to be there because there was a lot of people and they were very welcoming. So I was just happy to be there.
Okay, Lucky, there's another thing. So you broke your arm, you went to CHEO, but something else.
Oh, so my scar over here, I had a crayon on my hand and I was running outside with big shoes that my big cousin had. So I was wearing them and I fell and the crayon pierced my lip and went through my mouth. That was when I was 2 years old. So now I have this, and yeah, I went to CHEO and I got stitches.
See, they patched you up just nicely. Yeah. Okay, so you were part of that Kids These Days campaign with CHEO. Did you modeled? Can you show me that one pose that you did? What was the pose like? Like kind of like. Very nice, very dapper, very nice. I'm going to give you this basketball. You can go make a slam dunk here and have fun in the kids zone. Lucky, thank you so much for sharing your experience with us, with you in CHEO and your family. We're really glad that you're okay. The arm's good. You're not going to jump on the bed too much anymore, but you'll give us a jump shot right here?
Sure.
All right, let's do it, Lucky. Woo! Through the legs. Nice, Lucky. Very, very nice. Back to you, Patricia.
Amazing. That's so great. That Kids These Days campaign is so powerful, so well done. And as I'm watching that interview, I'm thinking, okay, maybe a future actor or broadcaster, maybe a future doctor, and then there you go, basketball. All kinds of possibilities. So love that. We have a new guest joining us on the couch. Melissa Brett is Clinical Manager, Critical Care Transport Team. Thank you so much for being here.
Thank you.
So Transport Team, exactly what it sounds like. You look after making sure these little, from the tiniest to the slightly bigger patients get to the hospital or get where they need to go safely. And in many cases, they are incredibly fragile.
Yeah, that's true. We have gone out for babies that are 23, 24 weeks when they're born. And we take a mobile ICU with us. That's our biggest piece of equipment that we need to rely on to be able to get these kids safely to CHEO when they need it.
What all is involved in that? Because it would be the unit, it would be the equipment, it would be a number of pairs of hands, and probably a whole lot of reassuring of the parents too as this process is underway.
Yeah, absolutely. And CHEO has this wonderful family first kind of approach to everything. So we always want to make sure that we're supporting the family in addition to ensuring that our patients are safe. And, there's actually a lot that happens behind the scenes to make that happen. So a lot of people work really hard for these tiny little people.
I think all of us remember the first time you take your own baby home from hospital and you put them in the car seat and all of a sudden it feels like the whole world is a terrifying place and you're driving so slowly and gently, and I would imagine that's sort of magnified in these situations for these parents too, as they're allowing their child to go off. Do they get to accompany their child?
We try as much as possible. You can imagine if we have a mom who's just had a C-section, maybe it's not safe for her to come yet, but oftentimes we'll take dad with us, and that's, you know, baby's first plane ride or baby's first helicopter ride. So we try as much as we can to keep the families involved, and you know, it's tough, right? You deliver a baby, you don't want to be separated from them, so it's a big deal.
When you talk about all the prep that goes into it, there was an emergency situation that happened in this city not that long ago when suddenly little patients had to be moved, not that far, but had to be moved very quickly. What is going through your mind in a situation, seeing something like that, about just, you know, the pressure of making sure that you are delivering for these little creatures and their families?
Yeah, so that was actually really interesting. My team members were amazing. They got the call that there was an issue, that they were needed in there, and they jumped to it. We had extra people volunteering to show up, and they used some really cool equipment because the elevators weren't working. And so we had to actually get those babies down the stairs. And in some cases, you know, we had our stuff parked at the bottom, and these tiny little people were coming down, and then we put them in our great big deck and incubator and took them back to CHEO.
Wow. All of this transportation that you do, is it all funded, or are donor dollars key here as well?
Donor dollars are a huge part of what we do. So our equipment, one of our decks, that's what we call them, is about $500,000. That's just the deck.
Wow.
And then you add a ventilator, and we carry nitric oxide, we have tank modules, we have a monitor, we have pumps, we have all of these things, and it actually all said weighs about 500 to 600 pounds.
Wow.
And so, you know, a lot of what we have, we really rely on the donors so that we can get, you know, new technology when it comes out to keep our patients safer.
All of that physical weight and all the weight on the shoulders of you and your team. Thank you so much for this. Our other guest, of course, is Dr. Berman, in charge of research, and we want to focus in on research a little bit now as Jackie takes us back to CHEO. Jackie.
Thanks so much, Patricia. Now, we've shared stories of outstanding care, but CHEO is also investing in research. Now, the Children's Hospital is not only participating in clinical trial for certain pediatric brain cancers, it is leading the world. We are at CHEO's Medical Day Unit, where fascinating clinical trials into pediatric brain cancer is underway. Joining me now, we have Dr. Nirav Thakkar. Thank you for joining us today.
Thank you for having me here.
Just talk to us about the research that's being done here at CHEO.
Yes, so we have some exciting clinical trials that are happening at CHEO, and I can just give you a bit of background into it. So currently we are able to cure a lot of cancers, which is great, but there are a few cancers which we cannot cure, and at present, even the cures we are achieving, we have to compromise a bit in terms of the long-term effects that the treatment has. Also, not all trials or newer therapies that we want are available. They're very limited access in Canada, and of all the trials that are available in US, we only have 10 to 15% of the trials that are there, which are also mainly distributed around Toronto and Montreal. What we are trying to do here at CHEO is not only trying to get clinical trials here, but we are leading the clinical trials from here and keeping true to our two principles. We want to achieve cure without any compromise, and we want to achieve cure that is accessible to all the kids.
And we can do that not just for here and the families here at CHEO, but it has a greater effect as well.
That's correct. As I said, we are leading clinical trials from CHEO, and we want to make it accessible to all kids, and we are opening it across all pediatric centers in Canada, but we are not just stopping there. We are actually taking trials globally to make sure that each and every kid that needs this innovative therapies, which will achieve cure without compromise, we are making it accessible to all partners across the globe, which means we are trying to have something which is locally grown but has a global impact.
I love that. Thank you, Dr. Nirav. And that is exactly why donor dollars are so important and crucial to help funding for clinical trials like this. Do you have a message for people at home for programs like this and research like this?
That's correct. I would like to say that, none of these trials would have been possible had it not been for all of you, for all the donors who are so important to make this happen. And I think every dollar that is raised by donor and by the community is not just a fundraise. It actually is a lifeline and hope for all these kids and families who would have not had access to all these therapies without it, and happening here at CHEO and getting global impact.
Thank you so much. And you heard it from the doctor himself. Every dollar counts for donors and your support. So call in, come online, and make the impact for families and CHEO patients as well. So we'll take it back to studio for now as we continue our tour here at CHEO.
Thank you, Jackie. And Dr. Berman, they're underscoring it there. This was donor dollars making this happen.
Yeah, as you heard from my colleague, Dr. Thacker, these trials would not have been possible without donor dollars. CHEO patients would have had to travel across the country to get this access to these therapies for these really high-risk brain tumors, and now they're able to get them at CHEO. And as Dr. Thacker mentioned, these trials are being led from CHEO, but run across the country.
Amazing stuff, and that's our half hour. Welcome back to the CHEO Telethon. We're meeting some amazing kids and teens. They're incredible families and CHEO staff who care for our kids every day. It's our chance to show that we care too, with donations to help make CHEO even better, help them do what they do. We're going to talk more with Dr. Berman, who's the head of the Research Institute. We're also going to check in with Jackie Perez inside CHEO, and Jackie is one of our enthusiastic phone bank hosts with Steph Keys. Back to the two of them.
Steph, how's it going here? We having a good time here?
Always having a good time when it's the CHEO Telethon, Jackie. You know what also makes me have a good time? These guys. We do it for the kids. When you don't see me on TV, I have been dancing. We've been having dance parties. It's just been the best.
I love that. And again, every dollar counts for today. We feel the energy here. We're feeling the love. And we want to feel it from you at home even more so. If you have your smartphone, I think you have your smartphone.
I have my smartphone. Just take out your smartphone like this. You hit the camera icon. Just in case you need a tutorial, right? Little camera icon. You scan the QR code on your screen, and then it takes you to where you need to go.
That easy.
Easy and breezy.
That easy. But if you want to do it old school, you want to call it.
What's that number?
613-730-2436.
Which means CHEO.
There you go. That easy.
Patricia.
All right, guys, thank you. CHEO Telethon Day, all about the kids. We're going to see some of them at the end of the show. It's going to be awesome right here on the set. Hope you stay tuned for that. Rosie's hanging out with a bunch of kids as well in the Kids Zone, Rosie.
It's so much fun. Sharing is caring, and we're seeing a lot of sharing happening right here in the Kids Zone. There's a sharing of all those giant block pieces, passing one on from one child to the next. It's so much fun to watch how they're playing and having such a great time. Lots of energy in this part of our telethon, and I'm getting energized as well, loving all of this, loving all the colors as well, and watching the creativity as well. I mean, look at this fortress here. Loving that. Yes, you are making a house. Very nice indeed. And then dads are here building again with their daughter. I'm loving this. Again, like I said, sharing is caring. It's so much fun to be here in the Kids Zone. We're going to visit with so many families coming up a little bit later. Back to you, Patricia.
Okay, Rosie, thank you very much. And Dr. Jason Berman is president and CEO of the CHEO Research Institute. I don't know if it's because my youngest graduated from high school last year, but all of a sudden, all of the parents in here, it feels like phenomenal, the kind of energy they have dealing with their kids and everything that you've got on your slate. You're a researcher, you're an oncologist, you're the head of the institute. You're juggling, and you were joking that you didn't have to juggle like Zed does, but it's a lot on your plate. How do you manage everything?
Yeah, it is a lot, but it's all very rewarding, and one thing helps me learn for the other. And I think I'm able to lead the Research Institute in the way I do because I still work on the front lines as a clinician, looking after kids with cancer and blood disorders and conducting research myself.
And I love that you just said it's a good time in here today, too. You feel the energy. You're still obviously incredibly passionate about what you do. Do you feel like you're exactly where you're meant to be?
Absolutely. I feel so fortunate to be at CHEO. It is really like a huge family across the Research Institute, the hospital, and the foundation. We all work together with the same common purpose of improving the lives for children and youth in Ottawa and the other areas that we serve.
It is a beautiful thing. We've got a whole list of projects that your Research Institute is involved in. What does Think Rare mean?
Well, you know, Think Rare is a really interesting project because it leverages AI, artificial intelligence. And one of the things that we've been doing over the last number of years at the Research Institute is leveraging technology to try to improve care for kids. And the Think Rare project brought together the expertise that we have in rare genetic disorders at CHEO, led by Kim Boycott, who's one of the geneticists at CHEO. It brings together our health record, our electronic medical record, EPIC, and CHEO was one of the first hospitals in Canada to take on EPIC as their medical record. And it brings AI technology and created algorithms of people working together, the clinicians, the AI scientists, the data scientists, in order to be able to identify kids that would benefit from a genetic consult. And by having genetic sequencing, many of our patients go through this diagnostic odyssey where they see so many different medical specialists without a diagnosis. This helped identify those kids and has made diagnoses in kids where they didn't have a diagnosis before.
So for the parents of a child with one of those rare diseases?
For a parent of a child with one of those rare genetic diseases, it's gotten them answers, so they have a name that they can put towards this, and it allows them to understand, get the services they need. We now have this incorporated as part of regular clinical care, so it's moved from research into clinical practice, and now we're getting requests from across the country. How do they roll out programs like this in hospitals from coast to coast?
It's incredible because we talk about AI on a daily basis here on the radio, and often I get nervous, I get filled with trepidation, it sounds terrifying, and then every now and then there is a story about how it is having an impact in healthcare, and then you go, this can be a really, really useful tool when used for good.
Well, you know, you're right. I think part of the problem is the name. Artificial intelligence is a scary name.
Yeah.
Artificial sounds something bad. We don't like artificial. Intelligence sounds like it's really smart, but it really is predictive analytics. It's using technology, computers, machine learning to help doctors and nurses and other clinicians do their job better.
There are so many different projects on the go. How does that happen? Is there a huge, long approval process? Is there a big wait? Are there a lot of things that you would be doing if you had more dollars, more people?
Well, you know, absolutely, because there's a need in so many different areas. We develop a strategic plan that helps guide us, and that's with input from patients and families, staff, scientists, doctors, nurses, everyone across the organization that helps direct us, but we have to make choices. And so the more funding that we receive, the more opportunity for us to be able to impact that change.
And we love to know that you are impacting that change, Dr. Berman. Thank you very much. And you out there have a chance to impact that change as well by donating, putting your dollars in a spot where CHEO can make wonderful use of them. Jackie, Steph.
Oh, goodness.
We are here in the Lazy Boy Lounge where the phone lines are going off right now.
I've been chuckling, Jackie, because I think we forgot about someone. Do you remember the last Miracle match? We started the clock, and Zed was going to be juggling.
He was for 2 minutes, right? We promised 2 minutes for him?
I think he's still going.
Oh.
Zed? Are you a little tired there, buddy?
I'm good. Go for it. Another 300 minutes.
Another 300
minutes. Another 300 minutes.
He's with us all the way till the end, folks, and hopefully you are too. 613-730-CHEO, 613-730-2436. Let's make those phones ring. It doesn't look like you're doing anything.
I'm waiting.
You're waiting. Well, tell the people that you need a call.
Listen, I need a call, people.
Oh, doesn't he sound sad? Jackie, he sounds sad.
He sounds sad. Let's cheer him up. Let's get that number again. 613-730-2436. Again, we are wanting you to call in, keep us company here, get those phone lines ringing, because it's a little quiet here right now.
Wanting and waiting. Patricia, we got to get those phones ringing.
Absolutely. You guys are doing a great job. Thank you. We have another story to share with you now. And like adults, of course, kids experience a wide range of feelings. But for those with disruptive mood dysregulation disorder, they don't know what to do with them. And anger and outbursts are common. For Rowan Crosby, getting better came thanks to a unique combination of medication, a CHEO first, and his mom's relentless advocacy. Katie Griffin has Rowan's story.
Like many kids his age, Rowan Crosby loves snowmobiling and playing in virtual reality.
I have the Oculus Quest 2, and I like playing Pavlov Shack.
The 12-year-old is also a leading air cadet.
I hope to be an Air Force pilot. It would be cool to fly like an F-35 or F-22.
But the last several years have been a struggle.
It was really difficult.
for us, for our family, and of course, particularly Rowan, because he couldn't regulate his emotions. So we couldn't really go out in public because of outbursts and behavior.
Rowan had become physically and verbally aggressive and was diagnosed with ADHD and anxiety.
All right, come on in. We can just head in, have a seat.
His extreme emotional reactions.
Nice to see you again.
Leading them to Dr. Olivia McLeod at CHEO, who diagnosed Rowan with disruptive mood dysregulation disorder.
As part of that condition, it involves an emotional response to frustration that is far in excess of, what we would see in a neurotypical child.
Traditional treatments they tried didn't work.
Right, okay.
Pretty soon after I had diagnosed him, Rowan's mom, Stacy, had asked if I could use a more experimental medication protocol.
Dr. McLeod did a comprehensive investigation, consulting with outside experts before deciding to go ahead.
Dr. McLeod actually listened to me, listened to my suggestions of the things that I researched as a parent. I wasn't just seen as a parent who was Googling and looking for information.
It was a CHEO first, using a medication combination including a drug not often used for this condition to improve mood regulation and reduce aggressive behaviors. And it's working.
It made me have less anxiety, feel happier.
Before, he was a lot more flat and sort of depressed, and it was, as a parent, it's very concerning.
You can do it.
You could do it! But he's much more positive now. He does activities that he didn't do before.
We've really seen the needs in mental health escalate. The demands for our service are very high.
I'm not good at gym. Nor am I.
Okay, do your thing, Rowan.
Donations to the CHEO Foundation help fund the mental health program as a whole, including research and from the point of intake with one call, one click.
Very simple for families to call if they need mental health help and then speak to an intake worker about what services match their needs.
For the Crosby family, CHEO represents hope.
I don't know where we would be if we didn't have CHEO. It has really made a huge difference in our lives. So it means everything, really.
Rowan, proof that change can come from collaboration.
I love working with families like that, where we can really work cooperatively and as a team to help our kids.
And it's so easy when you're feeling defeated to want to sit down and just say, I'm done, and not fight. But I promise the fight's worth it.
I don't know.
There you go, and Rowan and his dad Adam are joining us here on the couch. Thank you guys for being here.
Thank you for having us.
Is it kind of funny to watch your story go by there on the screen with all of these people around here, Rowan? Yeah. Watching your family, and you have a great hat collection. You're looking good with the new hat here.
I've had it for a while.
You've had it for a while. We were talking about Air Cadets there a little bit. So how is that going? Are you loving Air Cadets? Is that something you really enjoy?
Yeah.
And how are you feeling generally? It sounded like, listening to you in that piece, that you're feeling a little better, things are a little more under control. Yeah. This is good? Yeah. And Adam, what are the differences that you are seeing in Rowan? Does it feel like almost a completely different person?
Much calmer than what he when he was younger, and my wife has done such an amazing job, with talking with CHEO and going through all the processes with CHEO to help him out.
Yeah. Well, I loved what she had to say there. I mean, obviously as parents, we know our own kids better than anyone. We see them on the good days, the bad days, all of it. And she really felt that she had a voice, and when she was doing her research, she was able to push the people at CHEO to take a look at some of what she was talking about, and then an experimental sort of medication situation that actually helped out, and what an incredible result.
Yeah, absolutely. CHEO actually listened to us. It was amazing that they kind of listened to some of our opinions on this stuff, and I believe it's called Matthew's Protocol that Rowan's on, and it's been great. Hey, Rowan.
Yeah.
And you guys have gone through a lot. You have a daughter who's also needed some help and care at CHEO. When you look at Rowan now and see sort of how he's able to control some of those emotions that were bothering him before, that he's not as flat and he's more, enjoying the kinds of things you want a 12-year-old boy to be enjoying, what is it you feel? What kind of gratitude are you feeling?
Oh, I feel like he's outside a lot more, out playing outside, and just seems a lot happier.
I'm dirt biking.
He likes his dirt bike a lot.
Awesome.
He got me a new one.
Really? That's nice.
Not new, but
yeah, new to you.
A TTR 125.
And we're not going to tell anyone out there that you also mentioned how much you love video games. Of course you do, right? That's, all the 12-year-olds love that stuff. Yeah. And how good does that feel to you that you can get outside, you can really enjoy Air Cadets, you can sort of be more focused at school? Does that make you feel kind of proud of yourself and where you've come from?
I guess.
These are tough questions, right? Yeah. Yeah. Well, it was lovely meeting you. It was lovely hearing about your story. I know there's so many parents that don't have the answers and aren't sure what the next best thing is for their kids, and to know that there are people out there who will support you when you are pushing for that treatment and pushing for those solutions is a beautiful thing. What would you say, Adam, to the people out there who are thinking about maybe picking up the phone and supporting CHEO?
It's such an amazing place, CHEO. They do so much for Ottawa and surrounding areas, and even reaching farther out than that. It's
because you guys are outside the city.
Absolutely, yeah. We're out in the country, and the doctors have been great. There's been a lot of phone calls to us to save on driving, help support CHEO as much as we can. It's an amazing place.
Yeah, absolutely. Really a pleasure to meet both of you, Rowan. Best of luck to you.
Question, can I show you a picture of my turkey?
You have a picture of your turkey? Okay, we're going to go get you want to show it on air?
Sure.
We're going to get some donations through the Miracle Match, and then we'll see if we can get that turkey picture on air. But this is our next Miracle Match where your donations are double.
This Miracle Match is sponsored by PCL Construction.
All right, Stefan, take it away.
Thank you so much, Patricia. I definitely want to see a picture of a turkey, so let's get that ready. But in the meantime, this next Miracle Match segment is brought to us by PCL Construction. A part of their philosophy is about building a bigger and better future, and of course that involves CHEO. So we thank them once again for their support. And we know that the Miracle Match means that we are doubling your money. So please, let's make those phones ring. Jackie, you know why I like this segment? Because it makes me want to talk about the new integrated treatment center that CHEO is building. 220,000 square feet? And that's bigger than the Canadian Tire on Carling Avenue. That new one, that monstrosity, is going to be bigger than that.
It's a massive new development, and I had a chance to look at it.
Amazing.
And we are going to get to that in a little bit, but for now,
we've already started the clock, I think. So what time is it? Let's start it up. It's starting up. Okay.
Let's do this.
Less than 2 minutes now. So you have less than 2 minutes to call 613-730-CHEO. 613-730-2436. We double your donations. Jackie, show us some math.
If you donate $10, it will be $20 to CHEO, $25, $50 to CHEO. But Stefan, there's a number that we've been saying all day long that I left. If you donate $1,000.
I was gonna up that number, Jackie. I'm like, $10,000 turns into $20,000.
PCL could match that. So we want to hear those phones ringing now. Let's hear it. Let's hear it.
Let's hear it. Oh, let's see. Any conversations over here?
Dan, you had a phone call. To what kind of, or who's calling in now to stories that are sharing to you?
Oh my gosh, Jackie, so many great stories. We just had a gentleman who was watching the telethon, and he remembered how CHEO was there for him and his family 22 years ago.
Sorry, Jackie, I need to know what time is it?
What time is it?
Just 1 minute left in this Miracle Match, so call now.
Just 1 minute left until the Miracle Match. And Dan, you were finishing off this story that a gentleman called in.
Yes, he called in, and he had CHEO support him and his family with their twin children 22 years ago. And as he was watching the telethon, he remembered, he called, he made a generous donation. Thank you so much.
Thank you again. And now is the time we will match that donation. So now is the key time to get that in.
Okay, how much time left on the clock? Oh, it doesn't get cuter than that. That's what inspires you to give. How do you say no to that face and that voice?
You can't. All you got to do is pick up that phone, call 613-730-2436, the fan.
Yeah, and if you can't remember numbers, just remember CHEO, 730-CHEO, right?
That easy.
Easy
That
for you.
easy.
Yeah.
We are doubling your donation now.
Miracle Match. Thanks. Patricia.
It took me months to figure out the 4 numbers and CHEO and all of that. Good job, Steph. Thank you very much, Steph and Jackie. And we're going to go back to the Kids Zone now. Rosie's standing by.
Thank you, Patricia. And I am standing by with Parker and big sis Kylie. And I was going through the list here, and Parker was like, yep, check, check. So Parker, once again here. Mom, Stephanie?
Yep.
Check. Dad, Matt?
Yep.
Big sis Kylie? Yep.
Yep.
2-time cancer survivor?
Yeah.
Oh, yeah, that's right. Last year, Parker, you were the 2024 Telethon story. What was it like making that film?
It was fun because it was one of the first times I was on the news, and it was just fun sharing my story and stuff.
I want to ask you what it's been like for you at CHEO, because as I understand it, about 2022, so about 3 years ago, a lump on your leg wasn't painful, but then it turned into something. Then you found out something.
Yeah, so I was just playing ball hockey one time, and my knee, I was just limping. Then after one time, there's a little bump behind my knee, and we went to the hospital, and it was either something bad or something else, and it was cancer. So then we did treatment, we did chemotherapy, and we did radiation to try to get it away, and then it went away, but then I got it back after the telethon, and then now we did radiation and chemo, and now we just got some good news. So
We're glad about that good news. Kylie, big sis, what's it like watching your brother? You know, of course you're protecting him, you're watching over your brother, but he is being really well cared for at CHEO, isn't he?
Absolutely. I mean, my brother's been my best friend my entire life, and I'm so thankful that CHEO provided this care for him because he deserves to grow up and be the amazing person he really is.
You are amazing as well. You both are, you're a team, and that's what CHEO is all about too. It's about that teamwork, isn't it?
yeah,
Yeah, and then I know that you're still into sport, aren't you?
yeah, I'm training to do hockey, and maybe I'll do soccer next year.
Come on, you are unstoppable. That's what it's all about. They're going to CHEO, getting the help that you need, and then you go, of course, why not? Parker, thank you so much. Really appreciate you. And big sis Kylie, thank you again so much. All the best to you, okay? Take care. Can you say, over to you, Patricia?
Overview
Patricia.
Patricia.
Nicely
done. Just call me Trish. That's what my friends call me. That's a little easier. Thanks so much. It's lovely to hear siblings saying nice things about each other. When my kids would occasionally do that, I'd try to pull out the phone and get it on video. Always too late. But this one is on TV, so that's awesome. Dr. Tyler Hartley is joining us now, an investigator at CHEO Research Institute, talking about teamwork. You work with Dr. Berman and the wonderful work that he does overseeing that. And we were talking about Think Rare, one of the wonderful uses of AI and some of that project. And that's part of a bigger program that you are overseeing, Care for Rare.
That's true.
Care for Rare? Tell me about that. What does that mean?
Yeah, so Care for Rare has been around now since 2011, so 14 years, and we're a nationwide project. We have 28 sites across the country, but our home base has always been CHEO. And so our main goal from the very beginning has been to help undiagnosed rare disease families access answers for why their child is experiencing certain clinical symptoms. And it's been what's taken us through this entire time. It's been motivating us from the very beginning.
Wow. Well, you touch on a couple of things there, that it seems that Ottawa in a lot of ways is often the standard, and some of what we do here ends up extending out across the country. You must feel very proud of that.
Incredibly proud, incredibly proud. Yeah, our team is, 20 people or so here in Ottawa, and then when you expand out to the rest of Canada, it extends to dozens more, and then we have collaborations with countries around the world, many of which emulate what we do here.
But talking about rare diseases, and you bring that up when it's undiagnosed, when they don't have the answers, so hard for families. One of my dearest friends had a long road in trying to find out what exactly was happening with her son, and that time when you don't know is so hard, and then often when it is a rare disease, your path is still hard. You may not know anyone else who's going through the same thing, and sometimes there aren't the same dollars that are there because there's only so many people that are in fact dealing with that.
Yeah, that is so true. That is so true, and it's one of the reasons why we make a diagnosis of a family here at CHEO, and then we try our best to get that information out into the public, into all of the scientific literature, so that the diagnosis that's made here can actually be used in order to diagnose families around the world, and then that makes a global connection, a community that can come together, support one another, those families, and then actually lead to hopefully more research in the future as well.
And that's a key thing about research. It's not just doing the research, it's sharing those findings, that knowledge translation piece.
Exactly. And that's another thing when I'm always nervous about technology. The fact that we can do that now so easily is a wonderful thing. What is it you love the most about what you do? What's the most rewarding?
I mean, truthfully, the best days for me are the days when we can have a doctor call a family and say, you know what, we actually think we do know what's going on here and that we can make those answers. And that's what gets me up in the morning and with a skip in my step going into work every single day.
And you're working with like-minded people. I bet you get a pretty excited reaction too.
Yes, yes. There's always cheers, especially when we've been around since 2011. We're still making diagnoses now on some of those families that, were the first week that I joined the program. Wow. And so, decades later, we really do become a family, a community.
Yeah. Give them those answers. That's beautiful. Thank you so much for sharing that.
Thank you. Thanks for having me.
And we are going to go back to CHEO now, where our children's hospital is building its future, and Jackie had a look inside. Jackie.
Thanks, Patricia. I mean, if you were recently anywhere near CHEO, you would have noticed the heavy machinery outside the hospital, and that's to increase the size of the hospital. Now, the tour took me to the construction site that will eventually become the brand new integrated treatment center. Behind me, construction is fully underway for the integrated treatment center that is scheduled in the next couple of years to welcome families and CHEO patients. Joining me now, we do have Natalie Fauvel. Natalie, just talk about the timeline for me with this wonderful project.
So the project, as you mentioned, started in April. So we broke ground in April, and the construction should continue until the end of 27. And at the beginning of 28, we're going to start consolidating our services for our families at the new integrated treatment center.
Let's talk about the need for the families when it comes to this center specifically.
So currently we have services for neurodevelopmental health, development and rehab, mental health services in several sites across the city, and we'll be consolidating those services so that there is one approach and an easier access for families to appointments.
We talked about the grand plan. This is just the first phase. Talk to us about just what CHEO's overall plan is for the future.
So there is a phase 1 redevelopment plan for CHEO that spans over the next 10 years. This is a large project under this redevelopment plan, but we have a number of other needs. The building is 50 years old and requires significant investment as well to keep things going and renew some of our OR suites, for example. We have the newborn screening lab project starting this year as well. So over the next 10 years, there will be significant investment and, of course, significant need to be supported by the community to make those investments.
I love that you brought that up, because when we talk about the community, how important and how big is the role that viewers and the community at large play for a project like this?
So for the Integrated Treatment Center, there is a large investment in provincial dollars, but there's also a large, significant investment required by the community. And for the rest of the redevelopment, we're heavily relying on the generosity of the community to help us deliver those projects.
Well, you heard it from Natalie. Thank you so much. Every donor dollar counts. We need your help and your support. So call us now and help donate and make a difference here for the lives of the CHEO patients and their families. We'll take it back to you in studio.
All right, Jackie, that is exciting stuff, watching that come together, and there's going to be a spot for research in there, Dr. Berman.
Absolutely. I mean, part of the integrated part of that treatment center is integrating research, so in development and rehab, autism, orthopedics, and bringing all of that there into that space is going to be amazing.
It all makes a lot of sense. As much as we talk about being a global community and how easy it is to communicate, if you can put all of that in one place and, for families, for the staff, everyone, it just seems like a wonderful solution.
One-stop shop.
One-stop shop. I like it. My thanks to Dr. Hartley and Dr. Berman for joining us this hour. We're going to wrap it up, but no 6 o'clock news. We're coming up to our final hour of the telethon. I hope you can stick around and join us for this. At the end of that hour, we're going to assemble the kids and show you exactly how much we've raised over these last couple of weeks and through the afternoon.
This hour of the CHEO Telethon is brought to you by Guardian Capital, investing in children and youth health and fueling their dreams.
Donate if you can. Monthly giving is one of the easiest ways to make a daily impact and help children and youth at CHEO. Consider becoming a monthly donor today. Call now or make your donation online at CHEOtelethon.com. Together, we can ensure that every child has the chance for a brighter, healthier future.